Dr. Albert MENSAH. I'm President and CEO of MENSAH Medical in Chicago, Illinois. What's different here is that we don't look at these particular disorders, anxiety, depression, cognitive disorders of the brain. Notice I call them cognitive, not psychiatric disorders. What we understand is that there's an underlying cause for the vast majority of these so-called disorders. We don't treat the name, we treat the underlying cause. And that's different. People will oftentimes, after they've tried all types of different arenas, they come to us. We're working to try to get this taught in medical schools because it is medicine. It is the next deeper level. Actually, it's several layers deeper than what it is that we are standardly taught in medical school. And the reason is because they yet in the system are not yet aware of these chemical imbalances. They've not really filtered into the didactics at any medical institution. So we're doing it the other way. We're trying to get things done with our patients, and if we can generate enough interest over time, doctors are already intrigued, eventually it'll filter into the entire medical system. But until then, we work alongside doctors, their primary care physicians, and we come to an agreement and understanding about how we can both work with the patient without being detrimental to either side. We meet with a tremendous number of patients now, literally from overseas outside of this country to folks who are in remote areas. Here's where just about every parent who has a child with autism has searched every nook and cranny of the galaxy of the internet to try to find help for their child after being told by primary care physicians, pediatricians, traditional medicine in other words, that there was no help available. And they came to us with a good understanding of paying attention to what their child is like, what kind of symptoms they had, looking at now at doing testing for these conditions. We're able to help improve and in many cases reverse autism. And as a result of that, we've got tremendous capacity where before or standardly people say things like, well, there's no treatment for it. It's not that there's no treatment, it's just that traditional medicine doesn't know how to treat it. They don't know what it is. And I want to emphasize that each autistic individual is one autistic individual. They're not all the same. But it's important to understand what the underlying keys, the underlying challenges, the underlying shifts are both broadly, but then specifically unique to the individual person. Bio-individuality is where we start. But there's another category that I'd like to talk about, and that revolves around depression in females, especially postpartum depression. We've come to understand there's a very specific chemical imbalance involved in that. So I want to give you one quick story. So there's a young lady who's approximately 60 years of age. She had a horrible relationship with the first 5 children. She had 6. They would not talk to her because she was rageful, she was angry, she was cold after her pregnancies, after the delivery. She came to us after 40 years of horrible, painful menstrual cycles, fibroid tumors, severe depression, and severe postpartum depression, including postpartum psychosis. What we determined was that there was a simple biochemical imbalance, just one imbalance that was causing the entire spectrum of her disorders. We were able to treat the chemistry. She improved tremendously, although she couldn't salvage the relationship she had with her oldest 3 children. Despite how well she was doing and they could see the visible results, the trauma was so powerful for them that they could not really just go there with their mother. But the youngest 2 kids, they now have a wonderful relationship with their mother. Mom, who had been suffering all of her life, and what she was told was, well, these are just menstrual irregularities, these are estrogen dominant phenomenon, these are issues that you're just going to have to live with, it's part of being a woman, there's nothing that you can do. Absolutely incorrect. The key is there are underlying causes. You have to know what to look for. But at MENSAH Medical, remember what we deal with, bio-individuality. We spend time getting to know you and your history. We listen very carefully. And that's the guide that we use to determine which tests you need. We treat that which most people believe is untreatable. The consultation program is excellent for individuals who really can't afford to be patients. It is a good starting point, but we also make it very clear in that process that if you're not getting real results as a result of just doing some cursory work, then you may need a more in-depth approach. And so from that perspective, we share the conversation with individuals, and it's not just a one-time situation. Our consultation process allows us to have almost a year's worth of discussion for many people. And for those who are doing well, they simply opt to remain in the consultation aspect of it. But for those people who really haven't improved after about 6 months or a year, then we start to say, listen, your condition is truly far deeper than this. You really need to consider being a patient so that we can have truly the in-depth perspective that is necessary for your particular condition. I wasn't looking for this approach to the treatment of individuals. A friend of mine who was a really good friend of mine in medical school said that she was experiencing this facility and I needed to come down and see what it was like. And when I went to this place, and I was all just stuck on myself because I was to toot my own horn back in those days, I was a brilliant neuroscientist. So I thought I was hot stuff. So I figured in the worst case scenario, if I went to this facility, I might be able to teach them something. Well, when I got there, after talking to the mentor and talking to a world-class psychiatrist there at the time, I was truly humbled. The ego that came into that room, left. They explained to me that you can't just give nutrients. Just like medication, you've got to have the right concentration, the right dosage, and the right combinations for each individual patient. That's why I said we talk about bioindividuality. You cannot just take random supplements. First of all, they may not be bioavailable. Number two, they're typically the wrong concentration. And if you take a multivitamin, it's even worse because many people have chemistries, they have challenges where the nutrients you would take off the shelf are making your situation worse, not better. So basically what we're doing is we're creating your own super powerful ultra nutrient protocol. And since most people don't want to take 15 different supplements twice a day, we compound it. And so compounding becomes key. In other words, we create your own designer nutraceutical supplement. People will take a supplement and it contains copper. What many people don't realize is that copper can create agitation, it can create anxiety, it can create depression, it can create impulsivity, it can speed your heart rate because copper takes dopamine, the neurotransmitter, and turns it into epinephrine. Epinephrine can speed up your heart. If your child is copper intolerant and you give them foods like kale, spinach, broccoli, sound familiar, or almond nuts, and then you wonder why your kids have little heads spinning around, it's because of the copper content in the very foods that you're giving them. Our chemical testing will give us the definitive as to whether or not this is something that you should continue to do or something not to do. You need to know who you are biochemically. It is the key to understanding the path that you take. What many people don't realize is that our business progenitors, our business mentors, worked with DHA in order to help develop the very testing we're talking about. DHA is an institution of pioneers. Their forebears worked with our forebears and came up with the best process, the original processes for testing and evaluation for the chemical imbalances that we are using as foundational in order to determine how to help you. I don't use any other lab other than Direct Health Access Labs because for us to be accurate, for us to get the results we're looking for, we have to have the lab that knows what it's doing. And for me, I don't like working with anything less than the best. So that's where DHA comes in. Our institutions have known each other for decades now and been working with them side by side for a long time. But if you don't have the right test results, you put together the wrong programming, people don't get better. So the testing needs to be accurate, and that's what Direct Health Access Labs does for us.